Teen Health Alert tonight about a new trend in death. We're talking about death doulas. You may be familiar with the term doula from childbirth. Some parents choose to use birthing doulas when it's time to bring a new life into the world. But more families are now incorporating doulas for end of life. Consumer reporter Jen Pachano explains how it's helping patients.
We spend more time planning our annual vacation than we spend thinking about the last phase of our life, and we need to do that. We need to be prepared.
Annie O'Neill has a background and a business in geriatric care management. As part of that, she offers her services as a death doula.
What we try to strive for is as few regrets as possible at a very challenging time.
Death doulas have been around for 15 years, originally working with hospice care, going to a hospital to be the first one in once a patient was given a terminal diagnosis. Rather than focusing on the people around the patient and their anticipatory grief, she says an end-of-life doula focuses on the patient.
I believe that no good decision is ever made in a crisis. I always try to help people stay ahead of the curve.
She helps patients talk about their pain management options, navigate decisions about care, and where and how they want to live out their last days.
And when I begin to notice signs of decline, even subtle signs of decline, I'm able to say to them, let's talk about some additional support.
Dr. Laura Hoeksema is the medical director for Cleveland Clinic Hospice. She agrees that it's better to engage with these kinds of services sooner rather than later.
We actually find that hospice is most beneficial for patients and their families when patients receive hospice care for weeks or months, where patients and their families really get to know our team. We can provide that guidance through the dying process.
She's seeing a shift in more people thinking about the dying process and things like if they would prefer to die at home or anywhere but home.
You think of when we come into this world, there are birth plans, there are birth doulas. There's a lot of education and reaching out to neighbors who've had children before and asking them what the experience has been like. And we haven't exactly done that same thing when it comes to death.
Death doulas also do legacy work during the final phase of life, conducting workshops at nursing homes to create projects with patients to help wrap up their life.
One of the things I saw recently in a cemetery was a fudge recipe on the back of the headstone.
That's awesome.
Are you kidding?
Loved ones are even creating glassware with cremains and fingerprint jewelry. Death doulas are even helping people write their own obituaries.
I want to say who I am. I don't want somebody to sit there grieving and sad and say, surrounded by her loved ones. Okay,
Fill in the blank.
Yeah. Tell us who you are, how you lived. Right? Put that in your last opportunity to speak.
Dr. Hoeksema says death has become less medicalized in this country and more personal. Both she and O'Neill say they'd like to see more people taking advantage of this kind of service. Jen Pachano, 19 News.